Hello, everyone. This is Dr. Clark from the Center for Hormone Health and Wellness. I want to talk a minute here about levels of hormones. And is there a right level, a good level, a bad level? People often ask me that. What's the right level? What level should I have? Well, I'm going to start out by saying is that there isn't a right level. There's better, and it really depends on the individual. Now, when I'm going to break this into both estrogen and then also testosterone. For estrogen, if you think about it, kind of during your lifetime, for women, during you're having normal cycles when you're younger, during a normal cycle, there may be days when your estrogen level, specifically your estradiol level, may be 400 or 500, and then other days during that cycle, it may be down into the teens. And this is normal for that to happen. So, point there being is that there isn't a right and a wrong level. There isn't a good level or bad level or so. And so, what we want to do with kind of once you're approaching menopause and those estrogen levels are very low, typically symptoms arise. And for low estrogen, the symptoms tend to be night sweats, hot flashes, vaginal dryness. Those are the big three that low estrogen tends to cause. So what we'd like to do with hormone replacement is really fix those symptoms. Now, we also have to realize that estradiol, the estrogen we use in treatment, estradiol also does stimulate glandular tissue. And for women, we're talking about breast tissue and uterine tissue. But we would like to keep that glandular stimulation of the breast tissue and uterine tissue to an absolute minimum. Okay? And so for this reason, I want to use as little estradiol as possible that fixes night sweats, hot flashes, vaginal dryness. Again, there's not a right and a wrong level that does that. But in order to keep the glandular stimulation to a minimum, we'd like to use as small a dose of estradiol as possible. Testosterone. Now, the ovaries during their cycles also make testosterone. Actually, most people don't realize this, many physicians don't realize this, that women make more testosterone throughout their lifetime than they actually do estrogen. So, kind of point there being is testosterone is a very important hormone for women, and testosterone is a much safer, it's a very safe hormone. So we get a lot more leeway with testosterone. Most women tend to feel their best in the range of somewhere between about 60 and to about 250. Now, that's a very wide range, but testosterone we get a lot of leeway with, and we can kind of titrate up and have your levels up somewhat as long as you aren't getting side effects from it. And the side effects from testosterone are mainly kind of nuisance problems. They're not dangerous problems. The side effects of testosterone for women typically are, gee, I'm breaking out in some acne, or I'm growing extra wild hairs, which we tend to do as we age anyway. So it's trying to keep those two symptoms under control with getting good levels that you feel good. But we get a lot more leeway with testosterone. I have some women who feel their best literally at about levels of 350. And I have some women that feel their best at 60 or 70, those levels. So it's not a right and a wrong level. We want to try to not get side effects, and that's just adjusting the dosing a little bit. And so subsequently, we want you to feel your best, control night sweats, hot flashes, vaginal dryness with as little estrogen as possible so we don't get the glandular stimulation. And testosterone, we get a little more leeway with. Have questions about any of this? Just give us a yell here at the the Center for Hormone Health and Wellness. We also do weight loss, the Center for Weight Loss Success as well. But give us a yell here. We'll answer any questions. I'd love to see you. We can go over your labs. Just get those labs checked. We'll sit down and talk about them. Thanks for listening. Take care. Have a good day.